Hello, I'm Shane Brun from the College of Medicine and Dentistry at James Cook University. Today I'd like to speak with you about a very important clinical decision rule, and that's the Ottawa knee rule. But just before I do, just a little bit about knee injuries. We know that knee injuries are very common. They're very common presentations in general practice and in emergency departments. Patients presenting with knee injuries usually receive an X-ray series. More than 92% of these patients, in fact, do not have a clinically significant fracture. Subsequently, these patients are receiving unnecessary irradiation, and the cost is not insignificant to the health system. Steele et al. In 1996 published a groundbreaking paper. They described a decision rule that could identify patients who were at risk of having a clinically significant fracture. Interestingly, it proved a sensitivity of 100%. That is, patients who did not fulfill the rule criteria did not have a clinically significant fracture and therefore did not require a knee X-ray series. So who does this rule apply to? This rule applies to patients who have sustained a knee injury within the preceding 7 days, and those patients aged between 18 and 55 years. So what does the rule state? The rule states a knee X-ray series is only required for patients with a knee injury with any of the following. They are aged more than 55 years, or there is tenderness at the head of the fibula, or there is isolated tenderness of the patella. Now that means after palpating the whole knee region, the only identified tender area is the patella, nowhere else, or they are unable to flex the knee more than 90 degrees, or they are unable to bear weight for 4 steps, both at the time of the injury and in the emergency department. That means transferring weight twice through each foot. Limping does not count. As with any clinical decision rule, we need to apply clinical judgment, and our clinical judgment must always prevail. We need to look at the study and see who were excluded from the study. And as part of the workup of the Ottawa knee rule, pregnant ladies were excluded from the study. So we don't apply this rule to pregnant ladies, as we don't know if it is a valid tool or not for this group. We have to be exceptionally careful in applying clinical decision rules with people who are intoxicated, uncooperative, or have an altered level of consciousness. Patients who have significant painful distracting injuries. If there's any diminished sensation in the region we're examining, or there's gross swelling in the region we're examining that prevents accurate and appropriate palpation. I'd like to thank you for your time with me today. I hope you find the Ottawa knee rule a useful decision rule in your clinical practice in identifying patients who have the potential of a knee fracture and therefore require a knee X-ray series. Thank you.